Good morning and welcome to the 2025 Annual General Meeting. My name is Ann Priestman. I have been involved with the college as a board member since 2015. I'm currently serving my 5th year as the board's president and chair. I'm a specialist in internal medicine and endocrinology and metabolism and have been practicing for more than 25 years in New Westminster. I would like to begin by acknowledging that this annual general meeting is being chaired on the unceded and traditional territory of the Coast Salish peoples, including the territories of the Hunkaminam-speaking peoples, the Musqueam and Tsleil-Waututh nations, and the Squamish-Snuneymuxw-speaking peoples, the Squamish Nation. I also acknowledge that all of you attending today remotely are located on territories of First Nations across this great province. We acknowledge the rights and title of BC First Nations, whose territories span across the province. These territories recognize that laws, governance, and health systems tied to lands and waters have existed here since time immemorial. Participating with me today during these proceedings are Dr. Patrick Rowe, Registrar and CEO, Mr. Graham Kierstead, Chief Legal Counsel and Deputy Registrar of Legal, and Mr. Mike F., Chief Operating Officer. I will now call the 2025 Annual General Meeting to order. I declare that we have a quorum of registrants in virtual attendance and that we are duly constituted for the transaction of our business today, which includes adoption of the minutes for the annual general meeting on September 27th, 2024. Presentation of the board-approved audited financial statements for the period ending February 28th, 2025. Appointment of the auditors for the current fiscal year. An in memoriam for registrants who passed away during the last fiscal year between March 1st, 2024 and February 28th, 2025. A president's report and a word from the registrar. Other business and questions from registrants, after which you will conclude this annual general meeting. For those of you joining by video, if you have a question during the proceedings, please use the Q&A feature found on the ribbon at the bottom of your screen. You can ask questions at any time, and we will answer them when we get to other business. I will now ask for a motion to adopt the minutes from last year's annual general meeting held on September 26, 2024, as published on the CPSBC website. I invite you all to cast your vote by selecting one option on your screen and clicking Submit. Here are the results. 89% have approved the minutes. The audited financial statements for the year ending February 28, 2025 have been approved by the board and have been published on the website. Just as a reminder, if you have a question about the audited financial statements, please use the Q&A feature found on the ribbon at the bottom of your screen. We will answer when we get to other business. I will now ask for a motion to approve the appointment of KPMG LLP as auditors for the current fiscal year. I invite you to cast your vote by selecting one option on your screen and clicking Submit. Here are the results. 83% have approved the appointment of the auditors. I will now ask for a moment of silence to remember and pay respect to registrants who passed away during the last fiscal year, from March 1st, 2024 to February 28th, 2025. The past year has been both engaging and productive for CPSBC as we underwent significant preparations for the transition to the new guiding legislation and began to action the 2024 to 2028 strategic plan. On behalf of the board, it is my pleasure to share some details of the progress and work that lies ahead. In July, it was confirmed by the Ministry of Health that new legislation for BC's health profession regulators, the Health Professions and Occupations Act, will come into force on April 1st, 2026. Under the HPOA, regulatory colleges will further their mandate to protect the public from harm and discrimination, support reconciliation with Indigenous peoples, take anti-discriminatory measures, and be transparent while respecting the privacy rights of individuals. As patient safety has always been at the forefront of our work, we look forward to aligning our processes with the HPOA's goal of enhancing public protection. It was also announced that as of November 29th, 2027, CPSBC will begin regulating 4 new professions: clinical perfusionists, medical laboratory technologists, radiation therapists, and respiratory therapists. We see this as recognition from government of CPSBC's ability to expand its existing regulatory framework to help improve BC's health system. Members of the board were honored to welcome Minister of Health Josie Osborne and Deputy Minister Cynthia Johansson to the board retreat this summer, where they discussed their goals and priorities for the future. We look forward to collaborating with the ministry as we transition to the HPOA and further our collective efforts to improve patient access to care. A notable action taken this year was the amendment of CPSBC's registration bylaws under the existing Act. In addition, further amendments that have been approved by the board are currently in progress. Both amendments are intended to reduce barriers for internationally trained physicians wishing to practice in BC. These steps to streamline registration processes and create innovative pathways to licensure are critical to address health human resourcing challenges. The board was also pleased to have the opportunity to meet twice this year with Superintendent Sherry Young, who has been appointed by the Ministry of Health to lead the newly established Health Profession and Occupations Regulatory Oversight Office. Under the HPOA, this office will oversee the 6 health regulators in BC and promote best practice in governance. We will continue to meet with Superintendent Young and her team as they develop new processes for board member appointments and establish the discipline tribunal. At last year's AGM, I announced that we had nearly finalized our 2024 to 2028 strategic plan. After a productive visioning session at the 2024 board retreat and extensive input from CPSBC's key health partners, the new strategic plan was approved by the board last November. The plan includes 4 strategic themes, which have already informed our priorities and will continue to do so for the next several years. The themes are anti-discrimination and anti-racism, which reflects CPSBC's commitment to being an organization that consistently upholds the principles of anti-discrimination and anti-racism in all of our activities. Enhanced engagement, which illustrates how we will be seeking opportunities to engage and work collaboratively with British Columbians, registrants, and key health partners toward continuous improvements. Indigenous collaboration, which highlights CPSBC's ongoing dedication to building authentic relationships and understanding with Indigenous communities and organizations. And finally, innovation and change, which conveys our role as a leader, influencing broader sustainable change in the healthcare system. Significant work has already taken place to advance these strategic themes. As part of our commitment to transparency and process, we have had several opportunities to engage with the profession on amendments to practice standards. Significantly, this past April, the board approved a revised version of the Access to Medical Care Without Discrimination practice standard, which focuses on ensuring equitable access to care for all patients. During the revision process, feedback was incorporated from registrants, key health partners, and groups that are more likely to face barriers when accessing care. We thank all registrants who continue to provide us with feedback on our bylaws and practice standards. We will continue to take action to achieve the important goals set out in the strategic plan and look forward to sharing further updates about our progress. That concludes my report, and I will now turn it over to Dr. Patrick Rowe.
Hello, everyone. Thanks for joining us this morning and taking time out of your clinical days. Grateful that you've come. As Dr. Priestman shared, we're taking strides towards implementing the 2024 to 2028 strategic plan. and I'm pleased to share some additional steps we've taken this past year. As part of our work under the strategic themes of Indigenous collaboration and anti-discrimination and anti-racism, we are committed to having a diverse and equitable representation in CPSBC's governance and leadership. In March, we hired a Director of Cultural Safety and Humility who will provide oversight to our work towards embedding anti-racism into our processes and ensure that engagement with Indigenous governing bodies, people, and communities is done in a thoughtful and meaningful way. We have also been implementing changes to make the complaints process safer and more accessible for Indigenous people based on the recommendations from the 2023 Critical Review. The most recent annual report included the number of complaints related to Indigenous-specific racism, and we will continue to publish this information going forward. We have also shared several anonymized case studies in the College Connector based on real complaint matters where the inquiry committee found that a registrant did not meet the expectations outlined in the Indigenous Cultural Safety, Cultural Humility, and Anti-Racism Practice Standard. These cases are intended to be learning opportunities to assist registrants in applying the standard in practice. Next week is the National Day for Truth and Reconciliation. CPSBC will be closed that day to allow employees to reflect on truth and reconciliation, both personally and in their work. And we urge registrants to also take time to deepen their understanding of this important day. We also note that this December marks the 10th anniversary of the Truth and Reconciliation Commission's final report being accepted by the Government of Canada. We will be using this important milestone to acknowledge the truths of CPSBC's past and to further our organizational efforts to take action based on the TRC's recommendations related to health. As mentioned earlier, the HPOA will take effect in April next year. CPSBC has been preparing for the transition since the HPOA received Royal Assent in 2022, and we are well positioned for the enforced date. After model bylaws were developed for all colleges by external legal counsel in 2024, our HPOA project team and other staff customized the bylaws to align with and advance our regulatory processes. From March to August of this year, we sought feedback on the draft bylaws from registrants, members of the public, and other healthcare organizations through a structured consultation process. Supported by our new Director of Cultural Safety and Humility, we are also in the midst of facilitating opportunities for engagement with Indigenous governing bodies, a process which will continue for future bylaw and practice standard amendments. Since the close of the online consultation, CPSBC staff and legal counsel have been thoroughly reviewing and considering all of the comments with a goal of imminently finalizing the bylaws. Following this, they will be published to our website, along with a summary of the revisions made as a result of the constructive feedback we've received. We are committed to ensuring a smooth transition to the new legislation. While many of the processes through which registrants interact with CPSBC will remain the same under the HPOA and the new bylaws, we will be providing detailed information through emails and the College Connector about any changes registrants should be prepared for. In addition, registrants can expect to receive an email invitation next week to a webinar series in late October and early November to share more specific details about the bylaws. These webinars will include question periods for registrants to seek clarification on the new bylaws, policies, and procedures. I encourage all of you to attend. As Dr. Priestman mentioned, we are looking forward to advancing public safety in more areas of the health system when CPSBC starts regulating clinical perfusionists, medical laboratory technicians, radiation therapists, and respiratory therapists. While we have 2 years to incorporate these new professions into our regulatory framework and operations, I intend to use this time to ready CPSBC for a successful implementation. Shortly, we will be hosting introductory meetings with applicable associations to learn about the educational requirements and scopes of practice for each profession, and to answer questions they may have about CPSBC that they can share with their membership. One of my personal objectives is to seek opportunities to speak directly with registrants and key health partners to better understand the issues that they are facing and to share details of our work. This year, I met with the medical advisory committees of several health authorities, and I hope these meetings will continue to be scheduled regularly. I've also been working with my counterparts across the country through the Federation of Medical Regulatory Authorities of Canada, having focused discussions on enhancing physician mobility between provinces. Finally, I continue to engage frequently with Doctors of BC on various matters, including the HPOA transition, and I remain grateful for the collaborative and productive relationship that we share. On a final note, I want to inform registrants that this will be the CPSBC's last annual general meeting, as AGMs are not required under the HPOA. Please know that my colleagues and I will continue to offer opportunities for registrants to connect with us through our engagement channels and in person. Thank you for joining us today. I will turn it back to Dr. Priestman to continue the proceedings. Thank you, ma'am.
Thank you, Dr. Rowe. I will now open the floor to any other business or questions. Just as a reminder, if you do have a question, please use the Q&A feature found on the ribbon at the bottom of your screen.
Dr. Rowe, Dr. Priestman, we have two questions related to the Health Professions and Occupations Act. One you have addressed somewhat, Dr. Rowe, but the first one is, what are the next steps for the implementation of the HPOA, and how will CPSBC ensure that it's not politicized and lead to unnecessary targeting of registrants?
Thank you. The HPOA implementation process I was just unpacking in my remarks, but as you heard me say, the bylaws are nearing a completion, and we're now in the process of recrafting policies and procedures that we can then share with registrants and the public in terms of how the complaint process, registration process, QA processes, all of the hard work that the college does will be unpacked once the HPOA is in force. I think by saying ensure HPOA is not politicized, I'm assuming that means with regards to the complaints process. The complaints process and the college core regulatory functions remain an independent process. The inquiry committee's work that has been work that we have done for years will continue under the HPOA. The discipline tribunal and the director of discipline will now be a separate entity under the superintendent's office. However, they are also independent. They are not a political function or a political department. So I'm optimistic. I think that the core principles of independent regulatory functions and apolitical or non-political regulatory functions remains intact under the HPOA. And I think the processes that we're building will substantially, for registrants, look very, very similar to what you've experienced in the past. And I think will remain fair, objective, transparent processes.
Thank you. One further question, which you have addressed, but maybe you could expand on it a little bit. Are you planning to organize any educational sessions about the HPOA, as it seems there's still some confusion?
I sure am, Dr. Singh. Thank you for asking. Please join these webinar series. These are going to be critical. We're going to generate a number of webinars over about a 3-week, 4-week period, and those are going to be specific to core functions. So we will have a webinar that speaks to the complaints process, a webinar that speaks to the quality assurance processes. And these are meant to be informative, but also interactive. The questions that I've had from registrants to date have been excellent, but quite diverse. And we're trying to find these opportunities through webinars where we can have very focused conversations and really try to deal with some of the confusion that does exist, and not surprisingly, given the fairly substantial legislation. So I'm hopeful. I continue to try to make myself available to medical communities and medical groups. Often those conversations are about HPOA, although at times the other issues are really the topic at the time. So I'm hopeful, Dr. Hussain, that through all of this, that I can help ease some of the confusion. We're obviously going to be using our website as well and communicating as best we can through our website and through the College Connector. But as I think you're pointing to, there cannot be enough communication on this topic, and my communications team and I are trying to find as many opportunities as possible to give registrants space to ask questions and explore what the HPOA means. So I'm hopeful, Dr. Hussain, but yeah, please spread the word about the webinars. And watch for your email, because I think those are going to be great opportunities.
Thank you. One further question. What are the benefits to registrants under the new regulatory framework?
Good question, Dr. Fung. And it really speaks to, firstly, the legislation and the role of the college is to the benefit of the public. We're here to protect the public. However, there are benefits to registrants under the new regulatory environment, and I would point to two key pieces. The first is that quality assurance programs, so to date that has included the prescription review program and the physician practice enhancement program, are explicitly in the new legislation separated from the complaints process. So I think registrants should look at that and realize that quality assurance programs under the new legislation are a very protected, safe space for the college to engage with registrants in supportive conversations without the registrants having a fear that the college is going to proceed to a complaints process. So I think that's a dramatic benefit, actually, and having it articulated so clearly in the legislation, I think that is important for registrants to recognize. The second example of the benefits to registrants is found in the language in the Act around standards advisors. And so the Act speaks to professional standards advisors, ethics standards advisors, and eligibility standards advisors. Those advisors must be members of the profession in good standing. They are appointed not by myself as the CEO, but by the board. And they must be the ones who are engaged in the development of standards for the profession. They will then bring those standards to the board for approval. If the board wants to decline to approve those, there are very explicit reasons in the legislation that the board must speak to if they are going to proceed to declining the standards. So I think the other benefit to registrants under the HPOA is that the voice of registrants in the development of standards is clear. There's a direct line of reporting to the board. And it's, unlike the HPA, a means of entrenching the voice of registrants in the development of standards that impact us on a day-to-day basis. So those are two examples, I think, of benefits to registrants that the HPOA highlights.
Thank you. Are there any other questions? Does not appear to, oh, one more question. Does the process that you just outlined protect the self-regulation of physicians?
Thanks, Dr. Costello. As a starting point, I would just remind all of us, including me as a physician, we haven't been self-regulated since the 1990s. We're professionally regulated, but our board has been and continues to be a mix of public and elected members. This is reflected basically in virtually all Western regulatory structures for physicians, to be honest with you. So the self-regulation piece has shifted quite some time ago. I I think what you're trying to speak to, though, is the sense of autonomy, and is our sense of autonomy protected? And again, I believe that the autonomy exists and continues to exist. I think the voice of the profession being entrenched at the advisor level is actually more impactful than you might imagine, and will ensure that the voice continues and continues. Autonomy is a nebulous thing, and can I tell you that autonomy doesn't shift over time? Obviously not, but I do believe that the processes that I just outlined, that the structures that we're trying to put into place, that the Act is speaking to, will serve that function of ensuring that the standards that are brought forward for the board to consider reflect the nuances of protecting the public, but also the nuances of how the profession functions on a day-to-day basis. What are the challenges that we as physicians face on a day-to-day basis? I think that balance is there. It's a new act. We're just rolling it out. And my job is to protect the public, but to ensure that physicians can be regulated in a way that reflects the unique parts of the way we work. So I'm hopeful, Dr. Costello, but it's a very good question.
There are no further questions, Dr. Priestman.
Thank you, Susan. We will now conclude the 2025 Annual General Meeting. The minutes from this meeting will be posted on the CPSBC website. Thank you once again for joining us today. Have a great weekend.